Thank you. Thank you. All right. Good afternoon, everybody. Like you mentioned, I'm Scott. I'm with Golden Ranch Fire District, and because we follow the whole mold of its team first, we've got Chris Grissom here. We both work in the Health and Safety Division and oversee some different areas. And really where this all started in working with Neil was Neil's study came out. We had an incident in our own department where we lost a firefighter, and while we've beefed up our EAP and had other services available, we've had a large influx of customers in EAP, as we like to call them. You know, we have our own workforce that'll come in and meet with Chris and try to get some resources, and we've had quite a few, an uptick in it. And so because of our concern based on what happened with one of our members and what we're seeing happen in southern Arizona, we wanted to see, well, what can we do about it? So Neil's study opened some eyes. We started to get together. We got together with Dr. Bobrow, and this is just kind of an overview of what we're going to try. So, Neil? I'm the slide master, so I'm the slide gatekeeper.
All right, so again, my name's Neil B. Hill. I talked to you earlier this morning. So we're going to cover just kind of an overview of the state of EMS mental health, talk about Golden Ranch Fire District, what their composition is, and some other facts about them. Go over the curriculum that they've developed. Then also I'll discuss the project design for the research study we're doing. All right, so I have these articles up here because I think it's important to know, that this isn't just happening in Arizona like our study showed. If you pull up Google and you search firefighter or EMT or police suicide, there'll be a litany of articles spanning Forbes, Vice, everywhere, discussing the epidemic that's going on. But I also have this up here because I'm about to give you a lot of stats. And I want to remind myself and remind all of you that there is an actual story behind each of these suicides. And they're not just statistics. So there's the person, the family, the community, the fire department that they're part of. So I think that's really important to remember as we go through this. All right, so what is the state of EMS mental health? Well, first let's talk about the state of suicide overall in the U.S. So suicide is the 10th leading cause of death for all ages in the U.S. and the second leading cause of death for people 15 to 34. So in 2017, there was over 47,000 suicides nationally with over 1.4 million attempts. So are we doing anything about this? Yeah, we're trying, right? But it's a tough thing to handle. So the NIH funding for suicide and suicide prevention has increased from $39 million in 2008 to $85 million in 2016. So you'd think spending $85 million a year would help stem the rise in suicide. But during that same period of increased funding, we saw a 15.5% increase in suicide in the national population. So beyond this alarming national suicide rates, we're specifically wanting to talk about firefighters. And firefighters have been found to have an even higher rate of suicidal ideation and attempts. So a 2015 survey of over 1,000 firefighters found that about half reported suicidal ideation and 15.5% reported making a suicide attempt. Another survey that we talked about earlier found 37% had contemplated suicide and 6.6% had reported making an attempt. And again, the CDC estimates about 0.6% of the general population has actually attempted suicide. So as you can see, there's some staggering differences between these reported surveys and what the CDC estimates is the national average in the population. So those statistics were kind of the background of Dr. Bobrow and I's project at trying to answer the question, what is the suicide rate in Arizona? So we conducted a retrospective analysis of 7 years worth of mortality data in the state, trying to answer that question. So our results found about 1,200 EMS suicides that were identified out of all of the deaths. And 63 of those, about 5.2%, were attributed to suicide compared to 2.2% of the general population. Now, the population of EMTs and firefighters is not made up of exactly the same race and sex as the general population, so we adjusted for different demographic factors, and we still found that EMTs had a mortality odds ratio of 1.39. So that's another way of saying that you had a 39% greater odds of dying from suicide than the general population. So those are pretty staggering statistics. And our next question was, is this something that's happening in Arizona only, or is this something that's happening nationally? So this is it's not even hot off the press. The next things you'll see, we're working on writing the paper right now, but I thought the findings were so important we should share them before they're published. So we conducted a national analysis, which was a retrospective analysis of 10 years worth of mortality data collected across 26 states. And so that represented about 1.5 million death records. And Arizona is not included in this. So this is kind of a cross-section of half of the country. So we used proportionate mortality ratios to compare firefighter and EMT causes of death to the general public. So I'm going to explain what that is, just so that you understand the magnitude of our findings. So a PMR is the deaths from, so if you're looking at the PMR for suicide in firefighters, it would be the deaths of suicide in firefighters, or the deaths of suicide in all workers, and then you times that by 100. So a PMR of 100 would indicate that for every firefighter that died from suicide, one of the general population died from suicide. A PMR of 200 would indicate for every 2 firefighters that died from suicide, only one in the general population died from suicide. All right, so what are our findings? So firefighters were found overall to have a PMR for suicide of 172, indicating they were 72% more likely to have died from suicide. Just pretty staggering. And I don't want to leave the police out of this, so a prior paper's been published showing about the same PMR for police officers. And then looking at past historical data from the 80s, this was an increase from then 132 from 1985 to 1998. So it was increased even in the 80s, maybe not as much, but it's even higher now. And the EMTs were found to have a PMR of 132, indicating they were 32% more likely to have died from suicide. And so these findings were in line with our findings in the state of Arizona. So interestingly, there's one group that had the highest PMR. So I was able to sort by sex, by age groups, and race. And the highest group were firefighters 65 to 90, had a PMR of 234, meaning that, you know, for every 100 in the country that died from suicide, 234 in the same proportion of firefighters died. So I find that's pretty interesting, because you would think that, well, one, suicide is the second highest cause of death when you're younger, and then it kind of tapers out. But you would think that all of these incidents that are happening on the job are creating the greatest stress, right? But it kind of leads you to believe that maybe the stress that we're experiencing is carried on beyond its accumulative effect that we need to take care of. It's not something that, oh, I can't handle this anymore, I need to retire. You know, I'm too old for this, right? So that I just want to share that with you. 234. So it's about a 200. Yeah, it's a lot. Right, I'll pass it off back to you, Scott.
So Golden Ranch, who are we? We're a fire district located on the north side of town, of Tucson. No, we're actually not a ranch, as our Northwest buddies back here like to make fun of us. But,
That's a huge ranch.
Yeah, huge ranch. So anyway, we have 10 fire stations covering 120,000 residents, 211 active suppression firefighters, 270 organizational members. We run approximately 16,500 fire and medical calls per year. Not super busy, but we do run a fair share amount of calls. So why now? So as he spoke about earlier, back in 2003, my buddy Colin here and I went through a fire academy with a fellow named Jose. Jose was a super good fella, up and coming, very happy, lucky go guy who was the kind of guy that would do anything for you. What we didn't know is Jose was suffering with mental illness, and he kept it pretty quiet and eventually died due to some mental illness issues. It affected us really hard, and it was a very difficult time for all of us. So one thing Jose would be super proud of is the many positive things that are happening now with the House Bill 2502. We've created a Golder Wellness app. It's an internal app on any type of device that you can click on anytime. It's got links to our peer support team members. It's got links to any type of mental health or psychiatric type services that you may need. Also, it's got links to our EAP, so people can use that at any time. It's also there for their families as well. And one cool thing also, as I know he'd be proud of, is the total culture shift. Because back in the day, it wasn't cool to come out and admit that you were struggling. The tough guy syndrome is kind of going away. And we get multiple men and women that are more than willing to come forward and express their needs, and it's a pretty cool thing. And I think I know Jose would be super proud of that. Some challenges for us besides Jose is we've had 3 firefighters leave Golden Ranch Fire in the past year and a half. One was medical retirement due to some PTSD that he suffered on a call, and 2 that were cited challenges with PTSD. We have lots of customers for EAP. Scott and I and Colin run our peer support area, and the amount of phone calls that we get for people needing help is too high. And one part of me is I'm glad that they're calling, but another part is we're trying to do anything we can to keep that number down as much as possible. And that's all you have.
Yeah, really with that last point, the relatable PTSD specialists don't grow on trees. I mean, and if anybody's done EAP services before, you're trying to get that, you want to call right away, you want somebody to be responsive and be able to get in and help. And a lot of times they're doing the best they can, but they aren't necessarily, they don't have the background that first responders have, and they don't have some of the relatability. They have a lot of the clinical stuff, but that's where, we talk a lot, and I see it all the time with firefighters being professional problem solvers, and we are. And so some of the stuff that we want to do is we want to say, well, how can we solve this problem? And a lot of the things that we've talked about today, really, the math and science of mindfulness and all of that different stuff that we're learning, like being the training chief for a few years and going through the program where now we're allowed to reset the fire, right? Or we're allowed to hit it hard from the yard, or slay the dragon for the wagon, or whatever you guys want to call it. We don't have to go right in, unburned side, and do all that because math and science tells us we can do it different. Well, math and science is telling us that we can do some of these mindfulness techniques and change the brain. So we figured, okay, how can we get with Neil and the university and people that know how to study it and actually put our people through there and see what kind of results we get? So that's been kind of the idea is we went on this journey of how do we take all of the stuff that we've been talking about today? How do we take breathing techniques? How do we take understanding to accept, controlling what you can control? And we did a lot of research. We kind of ran out. And we found, first we started with mindfulness-based stress reduction, because There's an actual certification. There's an 8-week program you can do. And it's at a very low cost of about 20 grand to get certified in all of this. When you go to San Diego, you knock out the program, you feed yourself, it's college. So that wasn't going to be super effective. So while we liked the program, then we found, okay, well, let's find an instructor that's already certified in that. And we went and took a couple classes with a couple local instructors, and great folks, great people, had a great experience. All the people in this room, especially the ones that have been doing the, doing all the yoga stuff together, and we can all sit because our minds are open to it, right? We're open and aware. But we were concerned that our workforce was going to eat an instructor alive if they were not relatable. There was some kind of flowery, hippy-dippy stuff. Now's the part where we're all going to hold hands and just cry it out. Those, while we might be able to be open to some of that, that 92% probably wouldn't be. So then we said, well, okay, well, what do we do next? Luckily, we started cruising Army Resilience, positive psychology, doing some Google searching, and we found a program called Mindfulness X. And what it basically is MBSR certification that this guy from the Netherlands took, dropped it into 8 weeks worth of PowerPoints. Forget his name, I didn't want to misstate it. Hugo Alberts. You can just use him, some dude from the Netherlands. But he did all the work with being able to condense it down to these PowerPoints and take the math and science of mindfulness and not charge you $20,000 for. So the three of us became Mindfulness X instructors. And so what you need to do to be a Mindfulness X instructor is pay for the program. So we paid for the program and started going through the entire program, kind of vetting out this at 8 weeks and then saying to each other, okay, what's gonna work, what's not gonna work, and jettison some of the things that we thought, okay, this is firefighter relatable, here's how we can relate it to a call or relate it to a stressor at work, and kind of thin it out, so to speak, so that it would be more palatable for a group of firefighters and remove some of those stigmas. So that's what we're trying to do, is we took this program, we kind of crafted it for our own. We got with the University of Arizona and Neil and then said, okay, so we have this thing, let's study it. How can you guys work your magic to say, does this work? Can we prove? Can we take a slide that just says, look guys, here's your brain before you do this, here's your brain after. Clearly it's affecting you, but we need to do it every single day. We have to actually put in the practice. So a brief overview of the curriculum of MBSR Light from the Netherlands that's been tweaked by firefighters is starting with attention in the now, understanding where your mind is, where you're shining your flashlight of awareness. We're referring to it as Navy SEAL box breathing because the Navy SEALs are awesome. If they're awesome, then you'd probably want to do it too and also be awesome. So making it more palatable. The second part, week 2. Oh, so with the box breathing, just like JT was talking about, we're just having them sit down as part of their exercise and do box breathing for 5 minutes. If you do box breathing for 5 minutes, chances are you've done 20 breaths. If you do 8, it takes about 18 breaths to start to stimulate that parasympathetic. So in week 1, we just have to practice and start a routine. So it's just 5 minutes to sit down, breathe, do that, and you're starting the process of making some of those changes. And it's cool because Navy SEALs do it. Week 2 works on automaticity, which the science that is referenced in there is that 90% of what we do is automatic. Just kind of rote conditioning for how we operate, how we react to things, and starting to bring awareness to that by all of the present things that you can do to monitor your senses. A simple task like brushing your teeth. When you brush your teeth, what does it feel like? What does it smell like? What are you thinking about? Everybody's got to brush their teeth anyway, or at least our department does, because it's in policy. There's a hygiene policy, so you have to brush your teeth. And so because of that, you might as well do this 2-minute mindfulness. And it's just slowly building on itself throughout the 8-week program, because in order to make any change, you have to consistently grind and make those changes. So really, we're teaching them once on Mondays. Every Monday we do an hour-long class. Then they have their homework assignments. It's really only 15 to 30 minutes max. And they check the boxes. Did you do your breathing? Did you do your body scan? Did you do this mindfulness eating of an orange? Because Navy SEALs do it. And then, before you know it, we're going into all of these same different things that Jamie talked about. There's a 3-minute check-in as you get into acceptance. You're basically, stop, where am I at right now? What am I thinking about? Am I tense? And what do I want to feel like? Because there's empowerment in controlling what you can control, right? I mean, a lot of times because we're doing so many things subconsciously, we don't know what we're feeling or why we're feeling it. So all of these awareness things just kind of culminate over the 8-week period to what? You end up having 56 days of about, hopefully, 15 to 30 minutes of mindfulness. If we can train people to kind of be more aware of what they're doing, that's how we're going to hopefully increase happiness, hopefully reduce those negative coping mechanisms that we have for stress right now, and do it at a peer level. And Chris, so we went on the campaign trail because we wanted to try to get as many people as possible and fight through some of those stigmas. And what were some of the negative resistance that you were getting when you're asking people if they wanted to be a part of it?
Negative stigmas where, am I going to get paid for this?
Yep.
I don't want to go to a class, just all that blah, blah, it's like poor me type stuff. So when we kind of went over actually what is going to take place, I think people started buying in on it. When we let them know, hey, this is something that's going to take place that's possibly going to make you a better mother, a better father, a better present member in your family at home, ways to cope with your stress, ways to deal with difficult calls, your sleep deprivation and stuff like that. People started getting on board. I think the stigma of wanting to get paid and this and that kind of went away when we described it. So what we are going to do, because there are people that do need to get home to their kids, they need to do pass on with their significant other, take the kids while the spouse goes to work in the morning. We're going to actually start videoing our 1-hour classes so we can utilize more people to take place in it. We had quite low numbers, we thought, originally, until we did offer the video portion. We did want everyone to be in-house, but we are willing to video it now so it can get to more people.
Yeah, and really the whole purpose is it's independent study. It's self-study. It's at your pace. You don't have to do anything weird in front of anybody else. Like, you can go into your bunk room, you can breathe it out for a few minutes and then check that box, because then at least you did it. Or you could eat your orange, or you could recognize that you've had a judgment situation with the flipping of a rubber band from one hand to another when you catch yourself, man, I'm really judging myself, or I'm judging somebody else. Real subtle things that it's not like you have to advertise so that you can keep your super cool, awesome persona. While we have to do our part by, as the leaders, into those big, important words that were spoken earlier and throughout of that authenticity. And we have to be vulnerable. And guys like Chris and I have to lead from the front and say, hey, we've struggled too. Why do you think this is important to us? This is important to me because I've had a lot of challenges. I've had to be I've had depression and anxiety stuff. I've had to be medicated at times. I've found other solutions, all those things that matter to say, you don't have to feel like this. You don't have to live like this because you're working in a difficult profession. You can still have a great quality of life, and there are other solutions. So it takes some vulnerability, and it takes being authentic, and I think even distilling it down to Dr. Hammerslag this morning is you got to align all those truths into being an authentic person. So we're trying to take that culture and say that's what we want our fire service to be. That's what we want. That's what we wanted to just instill in a culture overall, is that we're authentic, we're true to ourselves, we're true to others. I think that's, yeah, just kind of breeze through that, but the study's going to start on the 22nd. It'll go through 8 weeks, and hopefully we can come back in the fall at the next Resiliency Summit and present some of the findings. If we find it falls flat, or people don't follow through with the program, or whatever it is, then we're still continuing to uncover what it's going to take to get shift workers to be able to do some of this stuff. So either way, it's going to be a success. We hope that it is a success in certain ways instead of others, but we'll learn no matter what.
And like Chief said earlier in his presentation, if we can just help one person, it's a success in our mind. So that's really what we're trying to do.
Yeah.
All right, so I'm going to be talking about the structure of the research project behind